Good afternoon, everyone. Thank you for joining us today for the 2021 EPN COVID webinar series. Today, we are going to be talking about increasing COVID vaccine confidence through caregiver engagement. And I'm excited that we have Ms. Vinette Tyme from HouseWorks and me to share our experiences with you and our insights. And so thank you for joining us today.
Thank you.
So, hello, I'm Dr. Charlene Brown. For those of you that joined the 2020 COVID-19 EPN webinar series, you'll remember me. And for those that are new, it's a pleasure to meet you. I'm the CEO and founder of Learn Care Together, and we're partnering with MINCA, the Maryland National Capital Home Care Association, and the EPN, Emergency Preparedness Network, to bring you this webinar series sponsored by the Office of Preparedness and Response of the Maryland Department of Health. So special thanks to the Maryland Department of Health for having the vision to support this webinar series. If you'd like to learn more about MINCA, if you are with a home care agency in the state of Maryland, just go to the website minca.org and reach out to join this incredible network and community of home care agency leaders. If you'd like to join EPN, actually, if you're participating in the webinar, you have joined EPN, so welcome to the network. And if you'd like to reach me at my company, Learn Care Together, the email address is right there on the screen. Special thanks to the HouseWorks team, HouseWorks LLC. They are a large private independent home care agency in Massachusetts. The case management team, the scheduling team, the management team, with a special shout out to Andrea Cohen, the founder of HouseWorks, Scott Muir, one of the VPs, and Marcia Greenfeld, one of the key caregiver engagement specialists that was involved with the work of increasing vaccine confidence. And a special shout out to the entire caregiver engagement specialist team that includes Nicole and Gigi for all of the contributions you've made to the work we're about to present today. Before we jump into the work we're doing today, I want to give you a heads up about our upcoming webinars and workshops. So next week, Thursday at 11 a.m., we will have a webinar on addressing common COVID vaccine misconceptions among caregivers. We'll have Dr. Nadine Reddick and me, and we'll be doing unpacking a lot of the common COVID myths and misconceptions among caregivers and using science to really help you understand how to talk about those misconceptions in a way that is simple but clear and relies on the science behind the COVID vaccine. We're also going to do a deep dive workshop in May. The dates will be announced by email and on the website, but we're going to do a deep dive on how to increase caregiver vaccine confidence, kind of unpacking a lot of the things we're going to talk about today. For those of you that want a hands-on training, you can sign up once we announce them. It is my honor and pleasure to introduce Ms. Vinette Tyme. She is a trusted leader and the current Director of Caregiver Engagement at HouseWorks. So I've had the pleasure of working with Ms. Tyme for the past couple of months, and she has this very deep commitment to creating an engaged and empowered workforce of caregiving professionals at HouseWorks. She uses so many techniques ranging from peer-to-peer training, mentoring, outreach, and serves as a critical bridge between the caregiving staff and the office staff. She manages a team of caregiver engagement specialists that are critical to that role. But she had 30 years of building customer relationships for various organizations in her home country of Jamaica, Bank of Nova Scotia, the Jamaica Tourist Board. She's a former paralegal. So she brings this incredible career before home care into this caregiving profession, where she has helped the organization really figure out how to engage its workforce in a way that supports the work they do overall, but in this context is supportive of the efforts to increase vaccine confidence among caregivers. She's actually a pretty hot speaker. Like, she's been interviewed on the news and she's won a bunch of awards. And so thank you for joining us, Vinette.
Thank you very much for having me.
Absolutely. For those of you who don't know me, it's kind of weird to introduce yourself, but I will just jump in. So I'm a doctor, I'm an entrepreneur, and I've spent the last several years focused on innovation that is focused on the needs of the professional caregiver workforce and the senior care, long-term care industry. So I'm the founder of Learn Care Together, which is a consulting company that bridges public health, workforce, and a whole bunch of other things. CNA Simulations VR is an education technology company that is offering online virtual clinical simulations for CNA training. Caregiver Jobs Now is an employment platform connecting caregiving professionals to meaningful work in home care and senior care. But my life before this, I had nearly 20 years in public health. I was a deputy health commissioner of Baltimore City. I worked on antiviral drugs at the Food and Drug Administration, and most of my career before working on entrepreneurship and caregivers was working on global pandemics. And so this very strange moment in history has created an opportunity for me to bridge my past expertise in public health and my present expertise in working with caregivers. So it is both of our pleasures to be here. And I'm going to stop sharing my screen and just jump in. So the format for today's presentation is going to be a conversation. So I will be both sharing some of the work that I did, but also interviewing, creating a space for Ms. Tyme to talk to us about how she and how her team and how HouseWorks really took a very innovative approach to increasing uptake of the vaccine at HouseWorks. And so with that, I'm going to just start talking to you, Vinette. So congratulations. So Vinette was actually promoted to be the Director of Caregiver Engagement in January. And before that, she was in a coordinator role. But why don't you tell us first what exactly a Director of Caregiver Engagement does? Like, what is it that you do?
Okay. As the name, suggests, caregiver engagement. That's the most important part of this whole job. So we play a major role in workforce planning. That's work with managers to, proactively evaluate the workforce needs, pertaining to caregivers. We do screening and hiring of caregivers, orient and onboarding, new hire support. We schedule the caregiver, make sure they're scheduled for their first shift and support them and do check-ins. We evaluate them. We ensure that caregiver customer service, that's fielding, documenting, ensuring follow-up on caregiver needs, ongoing training among caregivers, tracking, discipline, mentoring, supporting.
Okay.
The bridge between the caregivers and the office.
Fantastic. So it's exciting because you actually had 8 years working as a caregiver, as a direct care caregiver yourself.
Sure.
And then you have moved into this role where you're serving as a bridge between the two different teams. How did caregiving professionals respond when they first heard about the vaccine?
There were a lot of mixed feelings. They were hesitant, some were accepting, and some had doubts, some wanted to know more. So there were a lot of mixed feelings when they heard about the vaccine. Hesitancy, of course.
What were their top concerns that the ones they came to you and told you about?
Their main reasons for their hesitancy was this thing came up too quickly, the vaccine. So they were like not sure that this vaccine that they have produced is or will do what they say that they will do. So there were a lot of doubts. A lot of them were just afraid that they might, during the process, it's something set out to hurt them, and with all the myths going around on social media, and So it was difficult.
Okay. Did you have your own concerns about the vaccine? And if you did, how did you handle that, given the role you had as an advocate for the vaccine?
I had my doubts initially, and that was maybe in December, early December, when we heard about the vaccine coming out. Had my doubts mainly about the timing, because I didn't know much. And was it safe? What will it do? What will happen? But I did a lot of reading on my own. I researched, I asked questions, of people who should know. And a part of it that comforted me was growing up back home in Jamaica, we got a lot of vaccines going to school. And I'm still here, I'm still breathing, we're still here, we're still breathing. And that gave me a bit of hope that I think in the long term, it may help.
Okay.
So I did a lot of research and made informed decisions.
Okay. Did you turn to anyone for advice?
Initially, yes, I did. I had friends who we went to high school together, and we do remain very close. And that's over like 30 years. And most of them are in the medical field here. And I reached out to them. So, we discussed the entire disease. We discussed what went on, because most of them were in the hospitals, so they had firsthand knowledge. And, we just spoke. We just had open conversations, and we shared, what was needed to be shared. That is the facts.
Mm-hmm. That's great. So when you reached out to caregivers initially about the vaccine, how would you categorize the different ways that people reacted to you?
Hmm. There were different groups.
Mm-hmm.
Some said no, just to know. Then we gave no reason, just to know. Then we had a group that said no, but I need to know more. But it's still a no, but it was a pleasant no. And then there was this group that said they're not saying yes or no. They were scared, the long-term effects. And there was this group that said yes. After all that they went through over the past year, they wanted to get back to a sense of normalcy. And there was the last group, the group 5, I would, group them as initially not sure, but yes, because I'm doing it, then okay, I'll do it.
Okay. So Vinette, you have such a beautiful smile, but it is partially obscured by the bottom of your screen. So could you tilt the head of your laptop? There you, beautiful, wonderful. Thank you so much. So these groups of caregivers, they sound very interesting. This last group that you talked about, you said that they did it because you did it. Tell us more about that. Like why would they care that you did it? Why did that have an impact?
Trust.
Mm-hmm.
And it was not because the vaccine came about and I was taking it. It was that I built trust among them. I was there supporting them initially last year when we had the pandemic. The office was closed, people were working remotely, but I was at a facility. So I was there, I met them every day, we spoke, I checked in, and they knew that I was always with them. And they knew that they could trust me because I was always there.
So you work for a home care agency. What were you doing at a facility?
At that time, I was care coordinator. So I was there in a supervisory role for caregivers and just mentoring, doing a similar set of tasks as the caregiver engagement specialist. But the CES is more intense, but the care coordinator was like a mentor, someone who went in if there was a problem with the clients, caregivers, they had problems, I was there, I was on spot. So that I was just seeing them during that dark period last year. I was there.
Okay.
So
it sounds like the work that you did long before the vaccine to support the caregiver staff and build trust during the darker days of the pandemic actually played a role in your ability to have an influence once there was a vaccine. Am I understanding correctly?
You're correct, yes. And when the vaccine came about, and I decided that I was going to take it. Mm-hmm. And when I told caregivers, naturally they would, some said, go ahead, I'm not. And then, you had the ones who said, all right, since you're taking it, let me know more. So they had their doubts, but because of it all leads to trust, and they have to believe that someone that they know, someone who comes from among them. Because first and foremost, I love caregiving. I'm a caregiver first and foremost, whatever role I'm in. So they look, and most of them I worked with for the most part of 8 years. So I had to build that trust, and they had to know that it was safe.
So it sounds like you became a COVID vaccine champion within HouseWorks. Were you the only one, or were there others on the caregiver engagement specialist team that?
No. Marcia, who's my peer, she was one who we really did a lot of work, made a lot of phone calls. She was my strength. We had a team of 4 persons, 4 individuals. And not all persons on the team, were readily accepting, but that did not deter them from communicating with the other caregivers, and questions that they could not answer, they sent them on to Marcy and myself, and dealt with them. So it was a team effort all around. But Marcy and I, because we were the ones who initially stood up and took the vaccine, and a lot of caregivers believed. So we had a lot more input in this exercise.
Okay, so if we look at this through the lens of a timeline, it sounds like in January, when the vaccine became available to caregiving staff, you stood up and Marcia stood up and became COVID vaccine champions, called many of the caregivers, encouraging them to go to get vaccinated. And there was a subset that was already ready. They were like, I've been waiting for the vaccine my whole life, get out of my way, I want to get vaccinated. So that's group 1. Then there's another group who's like, I'm not sure, but if you're doing it, I'll do it because I trust you, right? And then there's everybody else. So in February, Andrea Cohen, the founder of your home care agency, brought me in as a consultant to work with your team on vaccine confidence and vaccine hesitancy. What was the gap that I was brought in to fill?
The gap that you were brought in to fill was the gap that provided us with the facts. The gap that informed us of the many questions that we could not have gotten an answer for, and we could not get back to them in real time. What you did when you came on in February, when Andrea brought you on, which we're forever grateful, is that we got a chance to express the reasons why the rest of the caregivers were hesitant and the reasons they were, and then you provided us with the facts. But you allowed us, in layman's terms, to tell you what we thought it meant. And when we explained, what we thought it meant, and you said yes, then we went on and we spoke in layman's terms to our caregivers, giving them the facts in simple terms, I would say. And then that was when they really understood that you gave us a wealth of knowledge, a lot that I didn't know. When you came on, there was a lot that I got to know and still learning.
So couldn't you have gotten the facts from the news or just from reading? Like, what was the value add in terms of the types of facts that we worked on together? So in other words, how did you use the information that we discussed? And was it different from what you would have just read on your own?
Yes, it was. How I used it or how we use it, it was different if I had just read it on my own. Mm-hmm. Say they asked, oh, this vaccine is going to interfere with my DNA. Mm-hmm. And when you came on, you explained the process that it does not get into their DNA. So we got a chance to ask someone, sit and talk with someone, which is much different than just reading and interpreting the way we think. But we spoke to you and we asked you questions, you answered us, and we had a chance to ask the question on the answers too that you gave us. But you simplified it in such a way that we were able to communicate to our respective caregivers, and it made it much easier.
Okay, so to provide some context, Vinette, Marcia, and I did about 10 to 12 hours of intensive training on the COVID vaccine. Vinette can now tell you about where your genes are, how the mRNA is destroyed by enzymes. She has, the team now has a very deep knowledge of the science behind the vaccine. And in many ways, you might ask, why do they need that? It just doesn't affect your DNA, or it just doesn't, there is no chip in the vaccine. Or the facts are clear. But what we did was arm the team that was already trusted by caregivers with a deep knowledge, so that when the myths and the concerns were raised, they had the ability to unpack them in a really detailed way, so that the caregivers that were talking to them actually believed them. They already trusted them, right? So we could have created a model. This was kind of a vision between Andrea and myself. There could have been a model where I came in as the beautiful expert who says, I'm so smart, let me tell you all about the vaccine. But that doesn't, I'm not a credible messenger as a stranger to a group of caregivers at an agency I don't work at. So perhaps I could have come in and trained the management staff on the vaccine and had them, give lectures and talk to the caregivers about the vaccine. But that wouldn't have worked either, because the reason there's a caregiver engagement specialist team is because there's a gap between the management and caregivers. There's a large cultural, socioeconomic, and trust gaps often. Mm-hmm. So what you have here is this is a very standard technique in public health, in organizational development. You work with the team that people already trust, and you build their capacity to influence change. And that's what we did with Vinette and Marcia. They were already champions. They had already taken initiative and spent time sharing their own personal experience with vaccination to influence other caregivers to get vaccinated. But because there was all of this latent trust, by building their capacity, now we were able to implement a system through which they actually did outreach and engagement with caregivers about the vaccine and became recognized within the organization among caregivers as experts on the vaccine. And that expertise was valuable because of the pre-existing trust of the caregiver engagement specialist team and of Vinette specifically. So what do you, if we take a step back and look at the group, we talked about the group that was already waiting for the vaccine. They didn't need any convincing. The group that just trusted you, right? They didn't, there was no specific education. They just trusted your judgment and they got vaccinated. Then there are all of these other groups, right? There's the group that's like, no, no way, no how, never, right? And then there's the group you mentioned earlier that they're like, no, no, but I need more information, but they're still saying no. Then there's the group that's just terrified. They're afraid they're going to lose their fertility. They're afraid they're going to have some kind of strange long-term effects. And that scared group is also saying no, but they're saying no because they are scared. So we take these three groups. How did you approach them? That's what our education and training was focused on, how to influence those three groups. So how did you and Marcia approach working with those three groups? Did you have a class, like a Zoom call? Did you did you have a meeting? What did you do? I know what you did, but let's tell everybody.
Okay. The first thing we did was listening. We listened to them. You have to listen in order to learn and in order for them to soften up a bit and say, okay. So first of all, we listened to their concerns and we did not dismiss them. We did not let them think that, oh, those social media myths and all of those, that's trash, don't pay any money. Oh, you're coming, no. We listened to them and then we called them. We spoke to them individually. We made individual phone calls. There are some that we spoke to maybe 6 times, some 5 times. And most of these conversations lasted between 10 to 15 minutes. Can you imagine talking to someone for like 10, 15 minutes, at least 6 times, just for them to say yes? So we did a lot of one-to-one and a lot of following up. We followed up, with our caregivers, and we allowed them, we also followed up, but we gave them time. So it did not look as if we were pressuring them. So we gave them time to think about their decisions. And I think it helped. And some we just left. Some we said no, we just left them. And then they contacted us maybe 6 weeks after and saying, I'm now interested. And they expect you to find somewhere, get an appointment, and get them there. So that was another part of what Marcia and I had to do. And along with Andrea, who really supported us that way. She sent out links and we used them to have our caregivers sign up. We did it. So it was a lot of work. It wasn't like, okay, yes, okay, no. It was intensely done over time.
So I had a chance to go through the conversation, we went through caregivers that you spoke to, and looking at the time you spent with them, when you said you had anywhere from 3 to 6, 10 to 15-minute conversations, these weren't all at one time. These were spread out over the course of 1, 2, or 3 months.
Mhm.
And what I think there's some key lessons in the approach that Marcia and Vinette took that are rooted in listening, as she said. Each and every caregiver got a customized approach to engagement around the vaccine. So when Vinette is saying that she listened, she was listening to understand where that caregiver felt, where that caregiver fits on the spectrum from never to scared. And you'd think that there's some specific thing, like if you could just create a script, and then if you just say the script to each person, maybe that would work. That doesn't work, because each person had a different reason for being scared, or each person had a different set of information they were receiving from friends or family. And so what Marcia and Vinette did with their deeper knowledge, they were able to listen, they were able to use, we created some talking points for them, then fact sheets. They were able to use those fact sheets in one-on-one conversations with caregivers on the phone, but also because caregivers were coming in for COVID testing, there was outreach they were able to do at the time they came into the office. Why don't you tell us a little bit more about the different ways that you contacted caregivers, and give us some more illustrative examples of the types of conversations that you had with them. Like what would you talk about in conversation 1, and what would you talk about in conversation 5? It might sound like it was just redundant. Like tell us what you did on a more detailed level.
Okay. How we approached them, they would come, they would say, we listened to what they were saying. Some would say, hey, I don't want to take the vaccine because it may affect my fertility and whatever, you know, in the first conversation. And then we had the facts, we gave it to them. We thought we had it all set. And then when you spoke to them again, they came back with something else. Maybe they came back with a social media myth, you know, with a video, and we had to look at it, could not dismiss it. And then we had to approach them with the facts. So it was very intense when they came to test, because we did COVID testing at several locations. And when they came to get tested, you know, we spoke to them about it, about getting the vaccine. And some would say, okay. Some would say, yeah, some say, okay, I'll call you. You allow them, you know, you just say, okay. You don't hear from them. But then you have to approach them differently. Because some, when we approach them, they're happy to hear what we have to say. Some are very, stern. They're like, no. So we have to know when, know what to say, know when to cut a conversation and not continue it, and pick up maybe in another week. Not for if we started the conversation on Tuesday and it went a certain way, which was not pleasant, because they were very strong, and we could not lose our cool. And they were upset, and we had to say, okay, we won't approach them until the following Wednesday. And we joked about even the myths that they came with. That's how we call them, or we would say, okay, I took the vaccine, I'm not growing any hairs or any horns out my eyes, all those things. And then they laugh, And then we say, aren't you ready for the vaccine now? And they would think, okay, I'll do it. And then when you make an appointment for them to go and get it done, then they say, okay, I need more time. But we never gave up. It is a lot of due diligence that was involved and a lot of patience, different approaches, different caregivers, different reasons, different personalities, different culture, everything. So we had to approach them accordingly. No two caregivers were the same, I can tell you. And there's like over 120 that, you know, they weren't the same. They all were different. So we had to find ways, different means, different ideas just to get across, but it all worked.
Yes, I think that's great. So what I'm going to do is summarize some of the key themes that I heard you describe, and then we're going to open up the floor for Q&A. So again, find the credible messenger, find the people that are already trusted. There's no time to build trust and advocate for the vaccine. You have to find out who caregivers already trust and trust implicitly. And then those people are the people that need to know most about the vaccine. Facts don't matter in a vacuum, like they don't matter, like the facts are everywhere. But making sure that the trusted messenger has a complex understanding, a nuanced understanding of the things they may have heard some myths, and they may not be sure. They may not believe it affects your DNA, but they might actually believe that it could affect your fertility, and they might quietly be telling caregivers to be careful. You just want to meet the trusted messenger where they are, build their capacity, build their trust in how the opportunity that the vaccine provides, and then set them free to engage with the caregiving staff. But don't expect like a miraculous turnaround. Some caregivers, Vinette and Marcia talked to 8 times over the course of 3 months, just checking in. None of the conversations were to say you should get vaccinated or why haven't you gotten vaccinated. They were listening tours where they would listen and engage and share information and share their experience, and then follow up in a couple weeks. And what we found, based on the very preliminary analysis, it looks like about 76% of the people who initially said, among the people who have been vaccinated that initially said no, there were about 76% of them that went from no to yes through the conversations with Vinette and Marcia. And I think that's very impactful. And I just want to congratulate you for the work you did and the leadership that you have been demonstrating, because the value to your agency it's hard to even quantify. If you think about the number of clients that ask for vaccinated caregivers and the opportunity for safety that having vaccinated caregivers provides, you've done a real service. So with that, I'm going to ask if you have any words of wisdom for home care agencies that are struggling with staff who are skeptical about the vaccine. What advice would you have for them? And then let's do the Q&A.
Okay. First of all, I would say to them, listen to their concerns and then identify a staff member, whether from within the caregiver engagement team. Well, we stand out at HouseWorks having this team, which I think it's something to be really tried all over. It's a very important group, the caregiver engagement specialist team, to bridge that gap. So try and identify someone from within who the caregivers trust, someone who will listen to them, someone who shows empathy, understanding, and someone who is patient, because it's not easy Sometimes, but you have to be patient, and you have to know that you're dealing with individuals and they change their minds every second. So I would ask that agencies that are struggling identify someone who has been a part of caregiving. So not necessarily someone in management, because then most caregivers might feel that they're being forced to do something. But if they see if they do feel as if they can identify with someone, trust is very important, and they'll do it. They will.
That's wonderful. That existing trust that you have is why so many caregivers came to you volunteering their concerns. And I think that just speaks highly to the work you did even before the vaccine was available.
Just before we came on, at least 4 caregivers called me, and two have gotten their first dose, and 2 I just gave the number. And before I came in to do this webinar, they called me telling me when they have their first appointment. And those persons moved from a no to a yes. So it's a work in progress. It is.
So that 76% might be an underestimate. That's fantastic. All right, we have one question. So this is the time. If you have any questions, just put them in the Q&A at the bottom of your screen. We have a question from Dale Archer. Vinette, did you find that different clusters of caregivers who are different ethnicities or sex or genders spoke of different concerns or myths than other ethnicities? So I think he's asking if you saw some kind of clustering of belief systems within different communities of caregivers.
Naturally, yes, you'll have from different backgrounds. They come with different, I think I would say they came with different reasons. You found out, though, if you do a male and female, the males were more, they were more accepting of this vaccine than the females. And different cultural backgrounds came with different, won't divulge, but we got it, but we're getting there. We didn't isolate them, but yes, we did, Dale.
One of the things that you highlighted in our conversations was the importance of respecting the belief, even if you don't believe it. So whatever the belief is, however far-fetched it sounds, you have to approach it with respect and without scorn or disdain or any hint of negativity, because that's how you lose the trust.
Yes, definitely.
Even some of the far-fetched, seemingly far-fetched myths are rooted in really thoughtful analysis of the data that they have. Exactly. Okay, we have another question that is from Risa asking, how many caregivers does HouseWorks have?
We have maybe actively employed maybe about 220 to 230, yeah.
Okay. Risa has another question. Did you give caregivers help in actually finding a vaccine, scheduling an appointment? Oh, yeah.
Yes. Oh, yes. Still doing. Yes, we did.
Did you end up having to go with any caregivers to their vaccine appointment, or was it just scheduling assistance?
Scheduling assistance, and then having them call me after, or I call them after, just to follow up. And I always ask them, when is the next appointment? Because I follow up too, just to remind them. Yeah.
Okay. Do we have any more questions? If no more questions, I have a question. So last week was a pretty big week in the world of the COVID vaccine, with the rare side effect of cerebral venous sinus thrombosis coming to light with the vaccine from Johnson & Johnson. How how do you think that has or has not impacted caregiver trust or distrust in the vaccine?
Uh, just this morning, a particular caregiver called me and I asked, I'm looking, did you get your vaccine done? And she said, no, I was thinking about getting the Johnson and Johnson until, last week when this happened. And I asked her if she was, still interested in, and she said, yes, she was going to make another appointment. The ones that took the Johnson and Johnson, they decided that that was the one they wanted. And maybe for the past 2-3 weeks, we have had maybe about 6 or so caregivers who, waited on that one. And I have not had any form of conversations with them because of the sensitivity of the thing right now. To me, it's too early. You don't want to, more fear than or concern. So I have not spoken to them, but I don't see any hesitancies developing from that. People are just doing the other two that are available.
Okay, that's actually good news.
Yeah.
Um,
Yeah.
So Anastasia says, thank you, wonderful insights and advice. I agree, you are sharing wonderful insights and advice. We'll go back to the audience now to see if you have any more questions, or if you just want to share your own experiences with the caregiving professionals in your agency and their strategies that you've used to either engage them around the vaccine or challenges that you're facing. If you share them with the group, we can listen and we can share feedback if that's helpful. Okay, I think there are no, oh, wait, there's one more question. Does social media help? So I'm interpreting that to mean well, actually, the person who asked that, could you clarify, do you mean does the agency putting out messaging on social media help, or what do you mean? Why don't you go ahead and start answering, and then perhaps we can get some clarification just to make sure you're answering it properly.
So social media in anything is good and bad.
Mm-hmm.
In particularly with HouseWorks, we didn't go that route with the social media because there were so many myths out there, so many. And it was, instead, we heard positive things or saw positive things coming from social media. It was mainly negative things. So I think that if you want to formulate a reason for people to take the vaccine, social media might help, might not, but I think the best way to get the information across to our caregivers is having those individual talks or group talks if it's not possible. So they can sit and they can face you, you face them, and you can have a conversation.
So we're lucky to have the founder of HouseWorks in the audience today. And I'm going to, Andrew, if you're still there, I'm going to allow you to talk to see if you want to provide some insights about your decision not to use social media to target the caregiving staff. You're live.
But you can't see me, right?
Nope. Your wonderful voice.
Oh,
so welcome and thank you for joining today.
You're welcome. As long as you don't have to look at me right now.
Okay, good.
Well, I was listening to the whole thing with extraordinary pride. I have to tell you, Charlene and I just started talking about this, and it's how do you figure out a way to actually like do it. And when you think about sort of social change and you think about just making change in the world, yeah, social media might support it, but that's not at the getting at the root cause. And the root cause is the caregivers who have questions and they're unsure. And you know what Vinette did under Charlene's leadership was pretty extraordinary. I mean, I was taking, you know, scrupulous notes listening to the listening tours. I mean, you know, and you start thinking about your, you know, the people that you're around who might have some, you know, it doesn't happen in one conversation. It happens in many it's organic. And that's what I just loved about this process. And, you know, and we're not going to stop doing it. I mean, Vinette's going to be there. Marcia's going to be there. Everybody's going to be there. It's not like it's not like a sort of one stop, you know, and it might morph into different issues. You know, we went from the testing issue to the vaccine issue, and I'm sure there's going to be other issues that crop up. And, you know, just to have Vinette at the helm, you know, really ensuring, I said to her, she could do a much better job than I can. And I love that. It's true. And she did. She proved me right. So that's all good.
Thank you for that summary. And to be honest, we're all under Vinette's leadership. Could you comment on the social media question? Did you choose to use social media to target caregivers, and if no or yes,
Yeah.
why or why not?
Oh, sure. Sorry, I went off focus there.
It's okay.
But in terms of the social media, we didn't do much on social media. I mean, we have our basic social media outlets, and we do, you know, we probably use social media really more for recruiting caregivers that would, you know, that would work in a COVID environment. But you know, it like Vinette said, it's not in the sources of facts, like who believes what, you know, like if we put a link up there to the CDC, I don't think in terms of supporting caregivers that would have really helped, because they, you know, there's a more chance they'll listen to Vinette than they will read, you know, a CDC link. So we didn't, you know, we would put stuff on the HouseWorks. We have a HouseWorks Facebook page that mostly the caregivers watch, and we would put stuff, you know, we'd put stuff on that we felt relevant, and we would communicate out also in different ways. But you know, what really, you know, we sort of enhanced what Vinette did, but she did the lion's share of it from my perspective.
Well, I agree. Absolutely. Thank you. Andrea, for contributing. That's really helpful. And if you would just put yourself back on mute, that would be great.
Sure.
So my recommendation was to not use social media, because your home care agency social media is usually targeting clients. Like it's your audience is clients. It's usually used for business development, trying to draw people seeking home care to your agency. It doesn't seem likely that the agency itself is a trusted messenger on social media for caregiving staff. That may not be true in all cases, but I think it's probably not a high yield strategy. I do want to take a moment and acknowledge Nicole Brown from the Maryland Department of Health Office of Preparedness and Response, who's on the call. Nicole, just raise your hand if you have anything to say, or if you'd like to comment on the Department of Health's perspective on vaccine hesitancy among caregivers. I'm gonna click allow you to talk, and you could just say hi if you have nothing specific to say. But I just wanted to give you a chance to say hello.
Thank you so much. Thank you so much. I really appreciate it. But you know, our office, the Office of Preparedness and Response, really appreciates all the hard work that Minka does, and the network, you know, and making sure that, you know, they share a lot of information with their network. And it's just really important to make sure, you know, that it's all inclusive. It targets, you know, all communities and audiences that are affected specifically now by COVID-19. So we really appreciate supporting them, because they do so much great work, and even like this webinar is just wonderful to be a part of and to listen to. So it's really much needed information. So, you know, I fully support everything that all of you do. So thank you.
Thank you. We appreciate your support. Okay, I'm just going to do a quick scan to see if there are any more questions. And if not, I think there are not. I'm going to just share my screen to do a mini wrap up. But before I do that, Vinette, you were amazing. Kudos to you, to Marcia, to the Caregiver Engagement Specialist team that you manage, and to HouseWorks leadership for just having the vision to be really creative around engagement and increasing vaccine confidence. The numbers back up the approach you took, and really good work. It was an honor to be a consultant in that process.
Thank you.
Let me share my screen again. Uh-oh. Okay, so let's move beyond my bio to more information. So as Nicole mentioned, MINCA, the Maryland National Capital Home Care Association, is an amazing network. And to be frank, I said home care agencies in Maryland, but really the national represents DC. So this network is for home care agencies in DC and Maryland. You want more information about EPN, just use the email there, and you can always reach me and our company at hello@learncaretogether.com. Thank you so much for being a part of this. And don't forget that we have this upcoming training that we'll be announcing next week is really it's equivalent, sort of an abbreviated version of the deep dive that we did with Marcia and Vinette as they were working with caregivers. So if you have people who can serve as credible messengers within your organizations and you want to build their capacity to be vaccine champions within the organization, this workshop is the right fit for you. Or you can join our webinar next week and learn more about the types of misconceptions that are happening among caregivers and how to debunk them with science. So we look forward to your participation. Thank you for being a part of this network. And we are going to close out the webinar right now. Thank you. OPR, thank you, Minka. Thank you, HouseWorks. Thank you, Vinette.
Thank you. It was a pleasure. Thank you.
All right. Have a great day, everybody. Bye-bye.
Thanks all.